Dr. Osterberg, chiropractors are known to do adjustments, and, they kind of like correct the bone. And most of us have a little bit of a misconception how and what that is. For instance, some of us are even worried and are scared, when you grab the head and you go, and could you possibly kill us? I mean, after all, we see the James Bond movies and they go, and the guy lays dead. Shed some light on of what actually the real function is. I mean, how bone cracking do you, and what do you do, and what's the popping sound which we hear? Is that really? You know what I'm talking about?
Yes.
This all seems to be rather natural to you guys.
This is a great topic. This is a great topic because there are probably so many people that have thought I would like to try chiropractic, but I'm a little hesitant because I don't know what the risk is, and I don't really know what they're doing, and I don't know what's going on inside. So let's talk about this. First of all, it's a misnomer to think that chiropractic treatment realigns the spine. A lot of people think that their bones are all stacked up like a pile of building blocks or a pile of bricks, and that they get out of place and we put them back into place. It doesn't work that way. The bones are held together by soft tissue, by ligaments, by tendons, by muscles, by the strongest tissues in the body. And you can't just push them around. They're controlled by the muscles. But what does happen is the joints become stiff. They become tight. The muscles become tight, and we lose motion. We lose flexibility. So chiropractic manipulation, spinal manipulation, it doesn't realign the bones. It just loosens up the joints. Now, there's a neurological effect that we can measure. There's only two things that happen when we adjust the spine. The joints become looser, and they move better, and the muscles around the joints, they loosen up. You can use an EMG, which is a machine for measuring muscle function, and we can actually measure that the muscles around the spine relax. The tone comes down a little bit in those muscles, and that's really what's responsible for giving people a lot of relief from chiropractic treatment. Now, as far as the risk, let's talk about what happens with manipulation. When you stretch the joints out, very much like if your knuckles pop. You've heard that little clicking sound in your knuckles before. You stretch the joint, and there's a little expansion of gas inside the joint, and it makes a popping sound, and there's really no pain involved with that at all. As far as the risk of manipulation, every medical procedure has risks, and chiropractic is no different. The risk of significant injury with the neck is fewer than one case out of 200,000. Now, the risk of treatment in the lower part of the spine is fewer than one case per million. So really, it's very safe. If you compare it to what most Americans do with pain relief, it's much safer than taking over-the-counter medication like ibuprofen.
I see. So basically, you're loosening up the bones, and by loosening them up, so basically they're stuck together. They're becoming stuck together. Is that what it is? And
I don't know if I would say the bones become stuck together, but the joints become stiff, and they lose some of their flexibility. They lose their range of motion and their ability to move properly, to move with freedom. And manipulation loosens up those joints so that they do move better.
Okay. All right. And so even though this neck, cracks when you do it, it's just not enough, or it's just too controlled by the chiropractor to cause any harm.
I can't say that it'll never cause any harm, but the risk is very low. It's fewer than one incident out of 200,000 patients. It's very, very rare.
When are you coming to the 200,000 range, so to make sure that we don't...
we joke about that.
To make sure we give the card to somebody else.
we joke about that because the risk is so low. But if you are that one patient in 200,000, it's a serious and it's a significant risk. And that's why I feel it's appropriate for us to have this conversation with every single patient that we see. And we give them information on the risks and the benefits of chiropractic care, but I also give them the information on the risks and benefits of 13 other alternative treatments for neck and back pain. Because if they choose not to use chiropractic, they're going to choose another form of treatment, and most other treatments that the public uses has a higher risk than chiropractic care. So we want patients to be well informed and to make good decisions based on good recent information.
Well, it makes sense that any time, for instance, a surgery, a knife is involved, that just has to have a higher risk factor because there's so many things from injection, from miscutting, and of course the trauma a body goes through by being cut, being the anesthesia. It's just like it couldn't possibly be. Well, none of us. I'm almost sure that everyone listening to this video knows that or is afraid of a simple root canal. Simply because it is a surgery more in the end, if you really think about it, than of a chiropractic adjustment.
Yeah, absolutely.
Yeah. Well, all right. Here we have it. So basically loosening up the bones so that things flow again. A little bit like, when you're all stiff and you manage to loosen yourself up, and afterwards you feel a little better, right? It's a little bit like that throughout the body. Great. I love it. Thanks a lot.
Thank you.